Hello, we're rolling into another episode of the DRH show. As usual, I talk to interesting people within psychology, mental health, and well-being. Today, I'm joined by a research fellow from the University of Warwick. More recently, she was involved in a research project which looked into mental health screening study to protect students' well-being during the pandemic. Dr. Kristy Themelis, thanks for joining me.
Thank you for having me.
Okay. It's great to have you here, Dr. Themelis. Let's start off with you telling us your background, your trajectory in life, and how you ended up doing what you're doing.
Sure. So I'm originally from the Netherlands, so that's where I did my bachelor degree in physiotherapy. So I've actually moved around quite a lot in terms of disciplines and research focus. And during my degree and sort of shortly after I started seeing patients, I realised that I wanted to know more about pain in particular, because me and myself and my colleagues were seeing a lot of patients with chronic pain in particular, and it raised a lot more questions than sort of answers, and there was a lot unknown around how we could best support and help people with chronic pain. So that resulted in me moving to the UK, and I started my master's at King's College London, looking at pain research in particular. And the plan was always to complete the master's and return and continue working as a physiotherapist. But here we are sort of 8 years later, and I'm still in the UK, and I'm really enjoying it because I went on to do my PhD in psychology. So that's why I first really got immersed in the psychology side of things, still focusing and looking at chronic pain. We're very multidisciplinary. And after that, I moved to Sussex, University of Sussex in Brighton, and I worked there as a research fellow for a few years, based in a medical school. So again, a very different environment. And my research focus was chronic pain, in particular fibromyalgia and chronic fatigue syndrome, and trying to understand more about the underlying mechanisms and how that results in the pain and fatigue that a lot of people experience. And following that, I moved to University of Warwick, where I started last year, and joining my interest in chronic pain, but also mental health, I started working in the psychology department, where I am now, looking at the role of mental defeat in chronic pain. And subsequently, I've been involved in this project that you've been talking about to do with student mental health. So a lot of different projects, but I think there's still sort of a common thread through them.
The reason why I invited you for an interview is I come across with a news release from Warwick about mental health screening, which you already mentioned earlier. So if you could just give us a snapshot of what was the research about, and basically what was the reason why you've decided to carry out that research.
Sure. So the research you're referring to is the Warwick Recovers study, and it's short for responding to COVID-19 by enhancing resilience in students. And the project has really come about in result to the sort of current epidemic that we're finding ourselves in, and trying to better understand some of the challenges that students are facing in the current crisis, and also how we as a university can best support our students through that. And we know from previous research, for example, looking at the SARS pandemic in China, that it can have long-lasting effects on our psychological well-being. And of course, the current situation is very new. There are a lot of uncertainties. So it's really important to try and understand the long-lasting effects of the pandemic. So the research itself consists of 2 parts. And part 1, we're trying to recruit as many students as possible based at our university. And the study is done completely online, of course, making sure that it is accessible in our current climate. And we're aiming to recruit about 3,000 students to get a really good idea of some of the challenges that the students are facing. So we will be asking the students to talk about their response to the pandemic, how it has affected their studies, how it's affecting their everyday life. And we will also ask them to respond to a series of questionnaires asking about their mental health and well-being in particular. And we will analyse those responses, and that will be used to inform sort of future interventions or responses. And then there is a second part to the study. So a subgroup of students, around 500, will be invited to take part in phase 2 of the study. And that is the tracking part of the study. And there we will ask students to wear a wearable device, and this measures their moods and gives us basic information on their sleep and their activity levels as well. And that will give us, hopefully, a better understanding of how symptoms might change on a day-to-day basis. So they will be asked to wear this device for a total of 4 weeks. And of course, we know in 4 weeks a lot can happen in terms of variations, and there are a lot of different things developing. So we want to see how this is affecting their mood and well-being in particular. And with that tracking study, we will be looking at 2 groups. So both groups will receive the device, which they can also keep after the study, and they will be instructed to track their moods and activity levels and sleep. And there's a second group called the Tracking Plus group, who will also receive some more information about how best to monitor their health and well-being, and they will be given some tools to interpret those factors and how they could respond to them to stay in control of their health and well-being.
It really sounds like a really comprehensive research, and a lot of researchers are really into well-being and promoting mental health among students. So it'll really be interesting to find out what findings and what outcomes you would have out of your research. And of course, if my research is right, I understand you're also part of the Lifespan Health and Wellbeing group at Warwick. So I understand that you're basically looking at not just the mental health of adolescents, but also across the lifespan. So as a researcher, if you could just kind of explain to us what's the importance of studying the importance of psychological aspect within the lifespan.
Sure. So the Health and Wellbeing Group is a collective of researchers looking at, like you said, looking across the lifespan. And the really sort of overall aim is trying to understand better the processes and mechanisms underlying healthy living, aging and well-being. And I personally don't, I only research adults, but I know a lot of my colleagues are looking at children, and even, as young as sort of newborns, and looking at developmental processes. But I think the important sort of message there is that it's very multidisciplinary, and it's the overall sort of aim is to try and inform clinical practice and national health guidelines, so get a better understanding about some of the processes and mechanisms involved, and how those sort of basic research can inform future practice and guidelines.
I understand this would be a broad question, but I just want to hear from you. Could you give us some ways on how we could promote mental well-being across the lifespan?
Sure. So there is, of course, we're finding ourselves in a very uncommon situation at the moment. So I'll try to make it most relevant to that at the moment. I think the general advice from the Mental Health Foundation that informs the national mental health response is to try and appreciate that this is a very unusual situation we're finding ourselves in, and that it's absolutely fine to feel nervous and anxious about the current situation. And going back to the question.
Yes, so basically I was just asking like ways to promote mental health and well-being across the lifespan. And you're right that, you mentioned that we should try to link the way we look at mental health and well-being with the current situation. And I think that was what you're trying to discuss earlier. But I just want to go back to another aspect of your work. You mentioned earlier that you also work within chronic pain, because initially that was your original plan to work within chronic pain, and then it evolved into another aspect of well-being. So but please tell us more about your work within chronic pain. What's the latest research that you've published in that area?
Yes, so I have, I'm currently involved in a project that is looking at the role of mental defeat in chronic pain. So that is looking more at psychological aspects of living with chronic pain, and how it can affect the symptoms. But previously I was looking at it from a slightly different angle. As I mentioned, that was based in the medical school, and some of the research that I'm writing up at the moment is looking at the role of information, as well as the response of the nervous system to pain, and how that might affect symptoms. It's different from what I'm looking at today, but there's still a lot of overlap between the two, and the research that I'm looking at writing up at the moment is trying to understand chronic pain from these different angles, and getting a better sense of what is happening in the sort of different systems, if you like.
And based from your reading and based from the research that you've carried out within chronic pain, have you come across with psychological interventions that can be used to, effectively manage mental health and well-being for those who suffer chronic pain?
Yeah, so I think it's very important to think to look at the different ways that you can manage or cope with your chronic pain. Unfortunately, there's still a lot we don't know about chronic pain, and not all therapies or interventions are effective. And I think the main focus recently has been on trying to educate health professionals and patients as well about pain, because there are still a lot of misconceptions around chronic pain and how it can impact daily life. So trying to get a better understanding of what is happening in the body, what is happening, how it affects or impacts someone's daily activities and quality of life, and hoping that could give people a better sense of control or ways to sort of cope with their chronic pain. And I mentioned informing or educating health professionals as well, because it's so important to acknowledge that it can have a huge impact on someone's life, and making sure that people have access to the latest information and research around different conditions.
So Dr. Themelis, as you've mentioned about the research within chronic pain, it's kind of multi-layered. At one end, you're not just looking within the health and well-being of those sufferers, but also it also impacts the carers, their families, and as you've mentioned, the researchers and the health practitioners. So I was just wondering if you've also carried out a research looking at how those people who've got we're looking after the chronic pain, looking after people who are suffering from chronic pain. How does it affect the mental health of their carers and their families? Have you also carried out research in that respect?
Sure. I think that's so you're touching on a very important point there, and how it's not only, of course, impacting the person living with the conditions, but the people around them as well. And although I haven't done research myself on it myself in particular, but I know that as research trying to understand better how that impacts other people around, spouses and friends, and acknowledging that it can have a huge impact, and that not only does there need to be more support for people living with chronic pain, but also for the people around them, and providing them with tools and information and resources to provide that support.
I was the other day before this interview, I was scrolling through your Twitter feed, and I discovered that you were also involved in creating an infographic on sleep and student mental health. So if you could just kind of share to us the key findings behind that infographic.
Yeah, so that was actually developed by my colleague, Dr. Nicole Tang, who is head of the Sleep and Pain Lab at Warwick, where I'm a researcher. And one thing that that we've realised so far is the sort of impact of the current crisis on sleep in particular. And there's a huge increase in sleep problems, and not only among students, but among the general population. So this infographic was...
Or even the lecturers.
Well, yeah, exactly, everyone. And the key message of this, of the infographic, was acknowledging that it is normal to... that it is a normal response to having trouble sleeping, insomnia in some cases is normal, as there's so much uncertainty at this time. But at the same time, knowing that it will get better as we are sort of moving, hopefully moving towards a recovery. And it gave some basic tips and tools how to stay, how to sort of manage your sleep as much as possible. And one of the things, for example, was trying to keep a routine as much as possible, which can be very tricky at this time. But having some sort of structure during your day, as well as trying to make sure that your sleep is consistent, and following, for example, making sure that you go outside when it's light, so that your brain knows that it's light. I'm trying to stay awake, and then when it's time to go to bed, trying to make sure it's darker, and simple tricks like that can sort of help you get into a better routine. But I think acknowledging that it's also normal to not sleep as well as you maybe did before.
Especially if you have a lot of coursework. Actually, this conversation reminds me of another interview that I had with Dr. Richmond. We talk about the effect of social media, and I think that also ties into this conversation. As you've just mentioned, that there could be, the load of coursework could of course impact your levels of anxiety and stress as a student, but we cannot also discount the fact that social media would also have an impact within this. So I think that we also have to, because a lot of my viewers would also be students, we also have to emphasize that you have to be more reasonable, I suppose, with your use of social media, because that could also impact your levels of sleep. And I'm saying that from my own experience, because it's just, I know it sounds ironic that, I run a mental health website, and I also talk to people within mental health, but I also struggle with my levels of sleep because I'm kind of addicted to social media. And sometimes, I go to bed with my phone, and later on I would realize that it's already 1 a.m, it's already 2 a.m, and I still haven't been sleeping. So I think we also have to emphasize that the effects of social media. But those are really wonderful advices that you give, that you should try to realize that with workloads, with anxiety and stress, it could impact your stress. So try to minimize it by looking for outlets to manage your sleep. Now, we've been talking about the aspect of your work about chronic pain, and also about how to support students in relation to their mental health. And this actually reminds me of an article that I read this morning. It's from a website called The Critic. And I don't know if you've read the article. It was written by Cassandra Russell, and she goes on to say that basically, the article that she's written, it centers around 4 premises. She's saying that because of the way we're talking about mental health, it could be open to sort of gaming the system. So I'm just wondering, because you work within this area, so I'm just wondering, what's your take on that? That, on one end, where it's good that we're actually talking about mental health, but because of self-diagnosis, as what the author said, it could also be prone to abusing the system to sort of make it easy for the students to do their coursework. So what's your take on that?
Oh, that's interesting. I haven't read the article, but I agree there is a danger that comes with self-diagnosing, and of course, nowadays we have access to lots of information about mental health, and a lot of it can be very informative. But without without sort of the clinical expertise of how to interpret it and how to diagnose, for instance, it can be quite dangerous as well. I think the first, from sort of a university perspective, I think we're trying to be supportive as possible in supporting mental health, and making sure that there are resources out there, and students are aware of where to seek support if they need it. And the next step would be, if you are concerned about your mental health, or if you have worries about any behaviours or symptoms in particular, is to talk to a health professional and get hopefully a better understanding of how it's impacting you and what the appropriate support would be. I'm not so sure. I'm not sure what you mean exactly about gaming the system. Whether it would be, whether it should be. I hope that's not the first. That would never be the first assumption that people make when students present with mental health issues. It's important to listen to concerns that students have and take it from there, really.
The reason why I asked you if you could comment on the article is not really to invalidate lived experience of those who are suffering from genuine mental health, but I was kind of thinking about that because there's a support coming from the university, so students would be like, if I could self-diagnose myself as having anxiety or stress, therefore I would benefit from, allowances being offered by university in relation to a self-diagnosed mental health. But as you've said, it's important that, we rely on mental health professionals for diagnosis, so we could properly support those who are genuinely suffering from mental health diagnosis. Now let's move on to a bit more sort of personal questions, because the way I do this interview is I usually ask people about their expertise, about their research area, and I also move on to asking them about something more personal. So this is one of the questions I always ask people that I talk to. So you've done a lot of research on pain, on mental health, and of course research within the lifespan. Is there a particular individual or a particular piece of research which has the greatest influence on your work?
Oh, wow. Well, I've been lucky enough to meet and encounter many individuals who've been important in shaping my research career. But I think if I had to name one person, it would probably be my supervisor during my master's degree, Dr. Mick Thacker. And he has a background in physiotherapy as well, but is well known in the field of chronic pain research in particular. And before I started my master's, I thought I had an idea of what the research would be like, and how sort of the people who would be interested in that type of research. But actually, I realised during my master's that it's so multidisciplinary, and you can approach not only chronic pain, but many issues of many health issues from so many different angles. And in fact, I think that is one of the most important things to remember, is that we wanted to understand an issue, then we have to approach it from many different angles, working with lots of different disciplines, especially if we're talking about something complex such as mental health or chronic pain. And I think, it really opened my eyes, and to also make me realise that I could go on and start my academic career with this sort of more clinical backgrounds, and that I would be able to actually use those skills that I developed during my degree to approach a health issue from a particular angle. So I think that he would probably be one of the first people who sort of shape my career, if you like.
And you've also done some research on stress, I understand. So if you could just also explain to us how stress and fatigue are related.
I was particularly looking at the role of chronic fatigue, and how that relates to chronic pain. So we know that there's a lot of overlap between different conditions, and the majority of chronic pain patients report disabling fatigue as well, and a lot of patients with chronic fatigue report chronic pain as well. And so understanding that those often go hand in hand. There are still a lot of differences, but a lot of overlap as well. And in fact, when I was doing my research at the medical school, we were first trying to identify different subgroups of people who may have chronic pain, primarily without the disabling fatigue, and a group who would have chronic fatigue as their main focus without chronic pain. But in fact, doing that research, we realised that it's really hard to take those two things apart. And in fact, we ended up involving participants in our research where the majority had a combination of the two. So acknowledging that is you can have, especially when you're doing sort of clinical experimental research, you can start out really focusing in on a specific health issue, but then actually realize that there's a lot of there are often a lot of other health issues that go alongside with it. So we've managed to adapt our research to make sure that we were looking at both.
And it'll be interesting to hear that, how that your research within stress and fatigue progresses, as we've been talking about earlier. Because of the pandemic, we would imagine that there will be a lot of surge in cases of stress and mental health related symptoms. Now, Dr. Themelis, you've done a lot of work within, and as you've mentioned, this is overlapping areas within mental health, within health, and within clinical psychology, I suppose. So what's the most important thing you want the public to know about your work?
I think it's probably going back to sort of one of the points that I made earlier about research needing to be multidisciplinary, and if you want to approach an issue, understand an issue, then it's important to look at it from all these different angles. So I'm very fortunate to have worked with colleagues from all sorts of different backgrounds. So even though we might be officially based in psychology, for example, I have colleagues with clinical backgrounds, colleagues with a more sort of data analytic backgrounds. When I was based in a medical school, it was one of my colleagues had a philosophy background. So I think that is the most important takeaway message. Like, don't feel restricted by your initial training or degree, but actually see it as a advantage, and see how you can use the skills and knowledge that you've developed in a certain area and apply that to other fields as well.
Now, earlier you mentioned about some of the misconceptions about chronic pain, because you've been working in this field for quite some time. So if you could just sort of address those misconceptions, and not just in chronic pain, but also within mental health.
Okay, yeah. So I guess in terms of mental health, unfortunately, there's still a lot of misconceptions. I think one of the one that I hear the most still is, it doesn't happen to me, or it doesn't affect me, I don't have mental health issues. Whereas we know for a fact that in the UK alone, I think 1 in 4 people will encounter a mental health issue every year. And acknowledging that it is very common, and that it can happen to everyone, I think that's important. And the other thing that unfortunately still hear a lot is, when you talk about mental health, or when you research mental health, is the misconception that means that it must all be in your head, and it's almost saying, well, if it's not something that I can see, that I cannot necessarily see sort of physically, then it can't be real, or it's not real. And that's a very sort of dangerous misconception, and unfortunately still see it today, in that acknowledging that it's certainly real, it's happening to someone, and it can have huge impact on their daily lives and quality of life. And in terms of chronic pain, again, I think one of the misconceptions is that it's especially when it's maybe not necessarily immediately visible, is that it must be in someone's head, or it must not be real. And that's it's a very unhealthy message, I think. But luckily we're all getting better. We're sort of understanding more and more about chronic pain and mental health, and the prevalence of it. I'm optimistic that we'll only sort of improve, and we'll get better. Everyone will get better at understanding it, and supporting people who are suffering with pain or with mental health issues.
You mentioned about chronic pain being prevalent. Just out of interest, how prevalent is chronic pain in the UK?
Oh, I'm not sure about the latest figures, but I think it's 5 to 10% of the national population. One of the most common chronic pain conditions is chronic back pain, and that's actually very prevalent. I think one in 2 or 1 in 3 individuals will encounter an episode of chronic back pain during their lifetime. And we're talking about the financial burden. It's actually up there. I think that's one of the top 5 conditions that can have a huge has a huge impact, a financial impact. Not to talk, not even talking about the actual impact that it has and how many people it affects. So it's very, very common, and
it's complex. It could affect us financially and emotionally, and of course, let's say you're a parent and you're suffering from chronic pain. It could also affect your children, because you don't expect children to be, to look after a parent who's having chronic pain. So that could also affect their well-being. This is a rather interesting field that you've been into. So for some of the listeners, they might be interested to follow your footsteps. So can you recommend to us a good textbook as a sort of starting point to explore areas within health psychology, within mental health?
Well, if you're talking about, I think I'll have to relate it back to the chronic pain in particular, but acknowledging that there is a huge importance of mental health in that field. I think the textbook of pain originally by Melzack and Wall is still one of the call it Bibles of sort of pain research, and it's updated every few years to include the latest research, and I think that's a really good starting point if you like to know more about that sort of field in particular.
I'll include those the link to that book on my video description box. So for those who want to explore more about chronic pain and its psychological impact, they could learn more about it. This may sound like a rather cheesy question, but where do you see yourself 10 years from now? What's the big goal? Are you planning to sort of devise an intervention to help people and their family, help people who are suffering from chronic pain?
Oh wow, 10 years. Yeah, that is a long time. I think I would still very much like to be involved with research that can make an impact in people's daily lives and have an impact on their quality of life as well. So yeah, I think trying to continue doing research that can have an impact, and one of the ways to ensure that it does is to involve people living with the condition or having sort of lived experience, and involving them in research from the outset, and trying to understand what is important to them, and what they see can have an impact on their quality of life. And that's a sort of general focus of that has been a general focus of research more recently, where it is acknowledged that having the patients, for example, involved in your in the development of your research protocols, and making sure that it's aligns with their aims and goals is really, really important. So hopefully in 10 years I'll still be doing that kind of research that can be translated into the clinical practice or inform national health guidelines and have an impact on people's life.
Now, clearly what you're doing is quite stressful. There's a lot of work involved, and there's a lot of collaboration involved in what you're doing. So how do you relax? What's your distressing outlet?
Well, one thing that I really enjoy cooking.
Mm-hmm.
So I see that as a way to relax, especially now that a lot of us are working from home.
Mm-hmm.
Having that sort of outlet, and making sure that you're eating healthy but tasty, and I sort of keep sort of trying out new recipes and challenging myself. They don't always succeed, but it's nice to do something creative and come up with new recipes. And I think generally trying to stay active and go outside, even though I don't have to actually physically leave the house to do work. Just for forcing myself to go and get some air, or go for a walk or a run.
Mm-hmm.
I think the ways that I try to manage my stress.
Yeah. I envy you your patience for cooking, because I myself, I only survive with pasta and pizza, but
Oh,
I know it's unhealthy, but yeah, I try to compensate with workouts in the morning. Now, finally, Dr. Themelis, what else is in the pipeline, and where can we learn more about your work, and also tell us your social media platforms?
okay. Yes. So, but as you probably, as you can imagine, the sort of the current situation has had a huge impact on research and how it is being carried out. So hopefully, in the not so far future, I'll be able to resume face-to-face testing. So getting participants into the lab, and using experimental measures and methods to research. We've had to, obviously, the last few months had to make a lot of changes to research program and how it has been carried out. So we moved a lot of our research online, but of course there is also a lot of clinical research that we can't do at the moment. So in the next 6 months or so, hopefully we can resume testing, and that will lead to more research. So that would be sort of the most immediate goals. I'm trying to be more involved in social media. It's not something that comes naturally to me, but I do have a Twitter account, and I try to list or talk about the research that I'm doing, and we're always looking for participants to take part in research as well. So if that's something that you're interested in, then do get in touch. So that's probably the main social media outlets.
I'll include the links to your Twitter, because I think you're starting to gain traction with trying to publicize your research area on Twitter. So I'll include that link. Well, Dr. Themelis, it's been an insightful conversation with you, but unfortunately our time is up. Thank you for sharing with us your time and your expertise. I look forward to hearing more about your work.
Thank you very much.
Thank you.